The afternoon light filtered through floor-to-ceiling windows of Premier Medical Associates, casting geometric shadows across marble floors that gleamed like mirrors. Crystal chandeliers hung suspended from coffered ceilings, their light refracting into thousands of tiny rainbows that danced across walls lined with mahogany panels and gilt-framed diplomas. The reception area resembled a luxury hotel lobby more than a medical office, with Italian leather chairs arranged around polished brass tables, fresh orchids in crystal vases, and soft classical music flowing from hidden speakers. Behind the curved reception desk, constructed from a single piece of imported granite, sat three women in tailored blazers, their manicured nails clicking against keyboards as they managed appointments with the precision of air traffic controllers. This was the kind of place where wealth came for healing, where insurance cards were platinum, and deductibles were afterthoughts. The woman who entered through the heavy glass doors looked like she had wandered in from a different world entirely. Her cardigan was hand-knitted, the kind made from clearance yarn with small imperfections that spoke of careful budgeting rather than careless craftsmanship. Her shoes, sensible flats with worn soles, made barely a whisper against the marble as she approached the reception desk. Her handbag, though clean and well-maintained, bore the telltale signs of years of faithful service, its handles polished smooth by countless grips, its corners softened by time. She carried herself with quiet dignity, her posture straight despite the weight of whatever burden had brought her here. The silver in her hair caught the light as she moved, revealing a face lined with the kind of wrinkles that came from smiling through hardship rather than frowning through privilege. Her name was Elena, though no one in this gleaming temple of medicine bothered to ask. To them, she was instantly categorized, filed away in their minds, under a single, devastating label that would determine everything that followed. She was invisible in the way that only the overlooked could be, noticed just enough to be dismissed, seen just clearly enough to be judged. The lead receptionist, whose nameplate read Victoria in elegant script, looked up from her computer screen with the practiced assessment of someone trained to quickly sort the worthy from the unwanted. Her eyes moved from Elena's cardigan to her shoes to her handbag in one fluid motion, a scan so subtle yet so thorough that it could have been choreographed. The smile that followed was the kind perfected in customer service training, polite enough to avoid lawsuits but cold enough to maintain distance. Behind Victoria, two other receptionists continued their work, though their ears had subtly attuned to the approaching interaction like predators sensing movement in tall grass. The youngest, Jessica, fresh from her medical administration program and still eager to impress her superiors, glanced up briefly before returning to her screen with practiced indifference. The third, Carmen, had worked in upscale medical offices long enough to recognize the dance about to unfold, and settled back in her chair with the anticipation of someone about to watch familiar entertainment. The afternoon schedule glowed on multiple monitors behind the desk, a complex grid of names, times, and procedures that represented millions of dollars in medical services. Each appointment slot was valuable real estate, guarded jealously, and dispensed only to those deemed worthy of the practice's prestigious reputation. Elena approached the desk with the careful steps of someone who understood that she was entering foreign territory, her hand reaching into her handbag to retrieve what appeared to be a crumpled piece of paper and an outdated insurance card. The very sight of these humble offerings seemed to confirm every assumption the reception staff had already made about her ability to afford care in their establishment. Victoria's smile grew even more brittle as Elena reached the marble counter, her manicured fingers already moving toward the clipboard of forms that would likely send this woman back out into the afternoon sun with nothing but wasted time and wounded pride. The classical music continued to play overhead, oblivious to the small drama about to unfold beneath its elegant notes, while outside the windows the city moved on with its endless rhythm of commerce and ambition, unaware that in this sanctuary of healing, the oldest story in the world was about to be retold once again. The receptionist looked up with practiced efficiency, her expression shifting almost imperceptibly as she took in Elena's appearance. The woman before her wore a simple wool coat that had seen several seasons, its fabric showing the careful maintenance of someone who couldn't afford to replace things carelessly. Her shoes, though polished, bore the subtle signs of long walks on city sidewalks rather than rides in private cars. Most telling of all was the way she held her purse close to her body, not with the casual confidence of someone accustomed to expensive environments, but with the protective instinct of someone who had learned to guard her belongings carefully. Victoria's professional smile remained fixed in place as she delivered her first gentle discouragement. "Good afternoon. Do you have an appointment?" The question carried just enough emphasis on the word, appointment, to suggest that such a thing would be unlikely. Elena's response was soft but clear. "I was hoping to schedule one with your specialist. I've been having some concerning symptoms, and my regular doctor suggested I see someone here." She fumbled slightly with her purse, producing a referral letter that had been folded and refolded until its creases were permanent. Victoria accepted the paper with the tips of her fingers, as if afraid that whatever circumstances had necessitated its multiple foldings might be contagious. A quick glance at the letterhead revealed a community health center several zip codes away, the kind of place that served populations who paid with sliding scale fees and government assistance. "I see," Victoria said, her tone cooling several degrees. "And do you have insurance?" Elena nodded eagerly, producing a card from her wallet. The plastic was slightly warped from years in various purses and pockets, and the insurance company's logo marked it as the kind of basic coverage that paid for routine care, but often required extensive documentation and pre-authorization for anything more complex. Victoria examined the card with the expression of someone discovering an insect in her salad. Behind her, Jessica looked up from her computer screen, her young face already learning to mirror the hierarchical judgments of her workplace. "This is a Medicaid plan," Victoria announced, loud enough for the other staff to hear. "We don't typically accept this type of coverage for our specialist services." The words fell into the reception area like stones into still water, creating ripples of discomfort that Elena felt in her stomach. She had prepared for this moment, had called ahead to verify that her insurance would be accepted, had scripted responses for exactly this situation. Yet standing here beneath the crystal chandeliers, surrounded by the quiet luxury that seemed to mock her carefully maintained dignity, she found her voice smaller than she had intended. "The person I spoke with on the phone said it would be covered," she said, producing a small notebook where she had written down confirmation numbers and the name of the representative she had spoken with. "I have the reference number here." Victoria glanced at the notebook with barely concealed disdain. The pages were filled with Elena's careful handwriting, phone numbers and dates written in the precise script of someone who couldn't afford to lose track of important information. Lists of symptoms, questions for doctors, medication names with pronunciation guides written phonetically in the margins. It was the notebook of someone who took her health seriously, precisely because she couldn't take it for granted. "Well," Victoria said, turning to her computer screen and typing with the aggressive precision of someone making a point, "I'm not showing any notes about special coverage arrangements, and our next available appointment with the specialist isn't until next spring." The lie came so smoothly that Elena might have believed it if she hadn't seen Victoria's fingers hovering over the keyboard without actually entering any search terms. But Elena had become fluent in the language of gentle rejections, the polite dismissals that came wrapped in regretful smiles and administrative obstacles. She had learned to recognize the difference between actual problems and constructed ones, between genuine attempts to help and performative gestures designed to make her go away. Still, she persisted with the quiet determination of someone who had no choice but to keep trying. "Perhaps there's been a mistake," she said, her voice remaining steady despite the heat rising in her cheeks. "Could you check again? Or maybe speak with your supervisor?" The suggestion landed like a slap. Victoria's professional mask slipped just slightly, revealing a flash of irritation that someone of Elena's obvious station would dare question her authority or demand to speak with higher powers. Behind her, Carmen looked up with interest, sensing that the morning's entertainment was about to become more engaging than usual. "Ma'am," Victoria said, her voice taking on the tone of someone explaining something to a slow child, "I've been doing this job for 8 years. I know how to check our scheduling system. The doctor you want to see is completely booked. These specialists are in very high demand, and their time is extremely valuable." Elena absorbed each word like a small blow, but she didn't step back from the counter. She had come too far and waited too long to be turned away by presumption and prejudice. In her purse, along with her worn insurance card and carefully folded referral, she carried something else. Something that would eventually transform this entire interaction from dismissal to disaster. But for now, she was still just another unwanted interruption in Victoria's carefully ordered day, Another person who didn't belong in this temple of privilege and presumption. The morning sun shifted slightly, sending new patterns of light across the marble floor, while Elena prepared to try one more time to be seen as something more than her worn cardigan and secondhand shoes. The dance was just beginning, and neither woman yet understood that before it ended, everything about this pristine reception area would be different, transformed by truths that couldn't be dismissed with condescending smiles and convenient lies. Elena stood at the marble counter, her fingers tracing the edge of her purse as she processed Victoria's dismissal. The morning light through the tall windows caught the silver threads in her hair, creating a subtle halo effect that went unnoticed by the reception staff who had already decided she didn't belong among their usual clientele. Behind her, the waiting room's leather chairs sat mostly empty, their expensive surfaces ready to embrace the wealthy patients who would arrive later for appointments that actually existed on the schedule Victoria claimed was completely full. "I understand the doctor is busy," Elena said quietly, her voice carrying the patience of someone accustomed to fighting uphill battles. "But my symptoms have been getting worse, and my regular physician was quite concerned. Surely there must be some way to get on a cancellation list, or perhaps see one of the other doctors in the practice." Victoria's sigh was audible, designed to convey the burden of dealing with someone who simply didn't understand how things worked in places like this. She glanced at her colleagues, sharing a look that Elena intercepted but chose to ignore. The young receptionist, Jessica, was watching the interaction with poorly concealed amusement, while Carmen had abandoned all pretense of working and was openly observing the entertainment unfolding at the front desk. "Ma'am," Victoria said, drawing out the word with barely hidden condescension, "this isn't a community clinic. Our doctors don't just see walk-ins, and they certainly don't take patients who can't properly compensate them for their expertise. Perhaps you'd be more comfortable at the county hospital?" The suggestion hung in the air like smoke, acidic and suffocating. Elena felt the familiar sting of class-based dismissal. The assumption that her worth as a human being could be measured by the designer labels she couldn't afford, and the luxury car she didn't drive to medical appointments. She had encountered this prejudice countless times in her life, but it never stopped hurting, never stopped feeling like a small death of dignity. Yet something in Victoria's tone, something beyond the usual classist disdain, sparked a different emotion in Elena's chest. Not hurt, but something closer to amusement. "I see," Elena said, her voice remaining calm while her eyes began to show hints of something deeper. Something that might have concerned Victoria if she had been paying attention to anything other than her own performance. "And you're certain that none of your doctors would be interested in seeing me?" "Absolutely certain," Victoria replied with the confidence of someone who believed her judgment was final and unappealable. "Dr. Harrison only takes the most complex cases, and frankly, whatever you think is wrong with you can probably be handled by a general practitioner at a much less expensive facility." Jessica giggled softly at this pronouncement, earning an approving nod from Victoria, who clearly enjoyed having an audience for her dismissal performance. Carmen leaned back in her chair, arms crossed, waiting to see how far Victoria would push this obvious mismatch between patient and practice. The marble floors gleamed beneath the crystal chandeliers, reflecting light that seemed to emphasize the contrast between Elena's humble appearance and the opulent surroundings that were apparently too good for her. Elena's hand moved slowly toward her purse, her fingers finding something among the contents that made her expression shift almost imperceptibly. The worn leather of her handbag had concealed many things over the years, practical items carried by a practical woman who had learned to be prepared for various situations. But today, among the usual contents, she carried something that would transform this conversation from dismissal to catastrophe. "Before I leave," Elena said, her voice taking on a different quality, something that should have alerted Victoria to pay closer attention, "I'd like to speak with the practice manager. There seems to be some confusion about your appointment policies." Victoria's eyes rolled with theatrical exasperation. "The practice manager is busy with important matters. She doesn't have time to explain basic appointment procedures to every walk-in who thinks they're entitled to special treatment." The words were chosen specifically to sting, to reinforce Elena's outsider status and make her understand that she was imposing on people far more important than herself. But instead of achieving their intended effect, they seemed to amuse Elena even more. A small smile played at the corners of her mouth, the kind of expression that might have worried Victoria if she had been looking at Elena's face instead of admiring her own reflection in the marble surface. "I think she might make time for me," Elena said softly, and something in her tone finally penetrated Victoria's performance enough to make the receptionist look up sharply. There was something in Elena's voice now. A quiet confidence that didn't match her worn cardigan or secondhand shoes. It was the voice of someone who knew something that others didn't. Someone holding cards that hadn't yet been revealed. The quality of light in the reception area seemed to shift subtly, as if the morning sun had found new angles through the floor-to-ceiling windows. Elena's fingers were still moving in her purse, seeking something among its contents, with the precision of someone who knew exactly where to find what they needed. Behind the granite counter, Victoria was beginning to sense that something about this interaction had changed, though she couldn't yet identify what was different. The morning had started so predictably, with its usual parade of entitled patients and routine dismissals of the unworthy. But now, standing across from this quiet woman in her simple clothes, Victoria felt the first stirrings of unease, though she couldn't yet name its source. Elena's smile grew slightly wider, not with malice but with the anticipation of someone about to correct a fundamental misunderstanding. The crystal chandeliers continued to cast their prismatic light across the marble floors, but the atmosphere beneath them had begun to change in ways that none of the reception staff yet understood. The morning was about to take a turn that would transform Victoria's confident dismissals into something else entirely, though she remained blissfully unaware that her performance was about to encounter an audience far more significant than her giggling colleagues. Elena's fingers finally found what they had been seeking in her purse, and when they emerged, they would carry with them the power to rewrite every assumption that had been made about her since she walked through those heavy glass doors. Actually, Elena continued, her voice now carrying a warmth that somehow made Victoria more nervous than anger would have, I think there might be a rather significant misunderstanding here. Elena's fingers stilled in her purse as she regarded Victoria with an expression that had shifted from patient to something approaching pity. The receptionist was still leaning forward with predatory satisfaction, clearly pleased with her performance and the effect it was having on her colleagues. Jessica had stopped pretending to work entirely and was watching with the fascination of someone witnessing a masterclass in professional dismissal. Carmen nodded approvingly at Victoria's handling of what they all considered an unfortunate interruption to their carefully curated client base. The marble floors continued to gleam beneath the morning sun streaming through floor-to-ceiling windows, and the classical music played on with oblivious serenity. But something fundamental had changed in the space between Elena's question about speaking to the practice manager and Victoria's cruel response. The air itself seemed to hold more weight, charged with the potential energy of a revelation waiting to unfold. You know what? Elena said, her voice carrying a gentleness that should have been alarming to anyone paying attention. I think I will wait for the practice manager after all. She moved away from the reception counter with unhurried steps, settling into one of the leather chairs that Victoria had implied were too good for her. The expensive furniture accepted her weight without judgment, wrapping around her worn coat with the same luxury it offered to designer suits and luxury handbags. Elena arranged herself with quiet dignity, crossing her legs and folding her hands in her lap, with the composure of someone who had decided to stop playing by other people's rules. Victoria watched this act of defiance with growing irritation. She had expected Elena to slink away after being properly put in her place, not to establish herself in the waiting area like she actually belonged there. Ma'am, Victoria called out, her voice carrying across the reception area with newfound sharpness. I told you the practice manager is not available. You're wasting your time and ours by sitting there. Elena looked up from her chair with an expression of serene patience. Oh, I don't think I'm wasting anyone's time. In fact, I suspect the next few minutes are going to be quite valuable for everyone involved. There was something in her tone that made Jessica's giggling stop abruptly. Carmen straightened in her chair, suddenly less certain that they were witnessing entertainment, and more concerned that they might be watching something else entirely. Victoria's confidence wavered for the first time that morning, though she couldn't identify exactly what was causing her unease. Behind the reception desk, a phone began to ring with the electronic melody that typically announced important calls. Victoria answered with her practiced professional greeting, but her eyes remained fixed on Elena, who sat in her leather chair like a patient time bomb, wrapped in hand-knitted wool. The caller's voice was urgent, though not loud enough for Elena to hear the words clearly from across the reception area, but she could see Victoria's face changing, the color draining from her cheeks as she listened to whatever information was being conveyed. Yes, ma'am, Victoria said into the phone, her voice suddenly smaller. No, ma'am, I haven't seen. What does she look like? Elena smiled and reached into her purse again, this time withdrawing a small leather wallet that she opened carefully. From it, she extracted what appeared to be a simple business card, though the way she held it suggested it carried more weight than its modest appearance might indicate. She didn't wave it or make any dramatic gestures, just held it quietly in her hand while she continued to watch Victoria's growing distress on the phone. Silver hair? Older? Wearing a cardigan? Victoria was saying, her voice now carrying a note of panic that made both Jessica and Carmen turn to stare at her.
Oh no! Oh no no no!
Elena stood up slowly, smoothing her worn coat with one hand while holding the business card in the other. She approached the reception desk again, but this time her steps carried a different energy entirely. Not the hesitant approach of someone seeking help, but the measured pace of someone who had allowed others enough time to reveal their true character. Victoria was still on the phone, frantically apologizing to whoever was on the other end, when Elena placed the business card on the marble counter with the gentleness of someone setting down a sleeping child. The card was simple, elegant in its restraint. It bore the logo of Premier Medical Associates, the same practice they all worked for, printed in embossed gold letters. Below that, in smaller text, was a name and title that made Victoria's face turn completely white. Dr. Elena Harrison, co-founder and chief of internal medicine. Victoria's phone slipped from her nerveless fingers, clattering against the marble counter before falling to the floor behind the desk. The sound echoed through the reception area like a gunshot, sharp and final. Jessica gasped audibly, her hand flying to her mouth in horror. Carmen simply stared, her mind struggling to process the complete reversal of everything that had occurred in the past 20 minutes. Elena stood quietly at the counter, her hands folded in front of her while she waited for someone to speak. The business card lay between them like evidence in a trial, its simple text rewriting every assumption that had been made about the woman in the worn cardigan and sensible shoes. The morning light continued to stream through the windows, but it now illuminated a completely different scene than it had minutes before. I believe, Elena said softly, the practice manager was looking for me. Victoria opened her mouth, but no sound emerged. Her throat worked silently as she tried to find words adequate for a situation that had no precedent in her 8 years of experience. She had dismissed dozens of patients, turned away countless people who didn't meet their practice's unspoken standards, but she had never mistaken the co-founder of the practice for an unwanted charity case. Jessica was crying now, tears streaming down her young face as she realized that her career might have ended before it truly began. Carmen had backed away from the desk entirely, as if distance might somehow protect her from the consequences of what they had all witnessed and participated in. Elena looked at each of them with the same gentle expression she had maintained throughout their morning encounter. There was no anger in her eyes, no vindictive triumph. If anything, she looked sad, the way someone might look when confirming a suspicion they had hoped would prove false. I think, she said quietly, we need to have a conversation about how patients are treated in this practice. All patients. The business card caught the light from the crystal chandeliers above, its gold lettering seeming to glow against the marble surface. Behind Elena, the leather chairs waited in silent witness to a morning that had begun with cruel assumptions and ended with devastating truth. The classical music played on, but its elegant notes now provided soundtrack to a reckoning that would transform everything about how this prestigious practice conducted its daily business. Victoria finally found her voice, though it emerged as barely more than a whisper. Dr. Harrison, we didn't know. You don't usually... Elena held up one gentle hand, stopping the torrent of excuses before it could fully begin. No, she said simply. I don't usually. That's exactly the problem. Elena remained standing at the reception desk, her business card gleaming on the marble surface like undeniable truth. The morning sun had shifted again, sending new patterns of light across the floor, but the atmosphere in the reception area had been fundamentally transformed. Victoria sat slumped in her chair, her perfect professional composure completely shattered. Jessica continued to cry softly, her mascara creating dark tracks down her cheeks as she contemplated the ruin of what had been, until 20 minutes ago, a promising career. Carmen stood pressed against the back wall, as if she could somehow become invisible through force of will. The phone on the desk rang again, its electronic melody now sounding ominous rather than routine. Victoria stared at it with the expression of someone watching a snake, afraid to answer, but knowing that ignoring it would only make things worse. Elena glanced at the phone, and then back at Victoria with raised eyebrows. "Aren't you going to answer that?" Victoria's hand trembled as she picked up the receiver. Her voice, when she managed to speak, was barely recognizable as the confident, condescending tone she had used earlier.
Premier Medical Associates? This is Victoria.
The voice on the other end was loud enough for Elena to hear, though she maintained the polite fiction of not eavesdropping. It was clearly the practice manager, her tone sharp with panic and bewilderment.
Victoria, what the hell is happening down there?
Dr. Harrison's husband has been calling frantically. She was supposed to be here an hour ago for her treatment, and nobody knows where she is. She's been having some serious health issues, and she made an appointment to see Dr. Rodriguez about some concerning symptoms. The appointment was under her first name only because she wanted to be treated like any other patient, not as a colleague. Have you seen anyone matching her description? Elena watched Victoria's face cycle through several emotions: confusion, horror, understanding, and finally a despair so complete it was almost comical. The receptionist's eyes darted between Elena's calm face and her business card, her mind finally processing the full scope of what had occurred. Dr. Elena Harrison, co-founder of the practice, had come in for medical treatment, deliberately choosing not to use her title or professional status. She had wanted to experience their patient care process as an ordinary person would, perhaps as part of understanding how their practice served the community. Instead, she had been subjected to class-based discrimination, insurance prejudice, and outright cruelty from the very staff she helped employ. Victoria stammered into the phone, unable to form coherent sentences. Elena gently took the receiver from Victoria's trembling hand.
Hello, Maria. It's Elena.
Yes. I'm here at the reception desk. There's been a rather illuminating morning, and I think we need to have a staff meeting. Could you ask Dr. Rodriguez to reschedule my appointment for later today? We have some more pressing matters to address first. The voice on the other end shifted immediately to concern and relief.
Dr. Harrison, thank goodness you're safe. Your husband was worried sick when you didn't show up.
Are you all right? Elena looked around the reception area, taking in Victoria's pale face, Jessica's tears, and Carmen's terrified posture.
I'm perfectly fine, Maria.
But I think we need to discuss how our patients are being treated when they walk through these doors. Could you ask David to join us? And perhaps cancel the next few appointments? This is going to take some time. She hung up the phone and turned back to the reception staff. The three women stared at her with expressions ranging from mortification to terror, waiting for the explosion of anger that surely must come. Instead, Elena pulled one of the leather chairs closer to the reception desk and sat down, her worn coat spreading around her like the robes of a judge. So, she said conversationally, tell me about your training in patient intake. What were you taught about how to evaluate who deserves medical care? Victoria opened her mouth several times without managing to speak. Finally, she whispered, Dr. Harrison, I am so sorry. I didn't know who you were. If I had known... Elena held up her hand again, stopping the apology.
Victoria, that's exactly the problem. Your behavior shouldn't change based on who I am.
Every person who walks through those doors deserves the same respect, the same consideration, the same access to care. A patient's worth isn't determined by their clothing or their insurance or the car they drive to appointments. But the Medicaid, Victoria said weakly, grasping for justification. You said we don't usually.
We accept all forms of insurance, Elena said firmly.
I know, because I helped write our patient acceptance policies. What we don't accept is discrimination based on economic status. She looked directly at Jessica, who was still crying.
And you, young lady,
what did they teach you in your medical administration program about professional behavior? Jessica's voice was barely audible. To treat all patients with dignity and respect. And did you do that this morning?
No, ma'am.
No, you didn't. In fact, you participated in mocking a patient who was seeking medical care for potentially serious symptoms. Elena's voice remained gentle, but her words carried the weight of absolute authority. Behind the reception desk, several other staff members had begun to gather, drawn by the commotion and the news that something unprecedented was happening in their usually orderly practice. They whispered among themselves, trying to piece together what had occurred, their faces showing varying degrees of shock and concern as the story spread through the office. Elena turned to address them all. "I think everyone needs to hear this," she said, raising her voice slightly. "This morning, I came to this practice as a patient. I wore my everyday clothes and carried my basic insurance card. I wanted to understand how we treat people who don't arrive in luxury cars or designer clothes. What I discovered was systematic discrimination that goes against every principle this practice was founded on." A young nurse approached hesitantly. "Dr. Harrison, is it true that Victoria turned you away?" "Victoria told me that our specialists don't see people like me," Elena replied. "She suggested I would be more comfortable at the county hospital. She lied about our appointment availability and made it clear that someone of my apparent economic status wasn't welcome here." The nurse's face went white. Several other staff members gasped audibly. Elena stood up slowly, her dignity intact despite everything she had endured that morning. "A question now," she said, looking around at all the assembled faces, "is what we're going to do about it." Elena stood in the center of the reception area, surrounded by the gathering crowd of medical staff who had heard whispers of the morning's events. The marble floors that had seemed so pristine and welcoming to wealthy patients now felt cold and unwelcoming, a physical manifestation of the barriers that had been erected against those deemed unworthy of care. The crystal chandeliers still cast their expensive light, but it now illuminated a scene of reckoning rather than routine luxury. Dr. Rodriguez appeared at the top of the curved staircase that led to the upper floors, his expression shifting from confusion to concern as he took in the scene below. Behind him came Maria, the practice manager, her face tight with worry as she hurried down the steps. Elena watched their approach with the same calm demeanor she had maintained throughout the morning, though those who knew her well might have recognized the steel beneath her gentle exterior. "Elena," Dr. Rodriguez called out as he reached the reception area. "What's happening here? Your husband has been calling every few minutes. We were terrified something had happened to you." Elena gestured to the three receptionists, who stood like defendants awaiting sentencing. Victoria had stopped trying to speak, her face frozen in an expression of horror that suggested she was still processing the magnitude of her mistake. Jessica continued to weep silently, her career aspirations crumbling around her like autumn leaves. Carmen remained pressed against the wall, perhaps hoping that if she stayed very still, she might be forgotten entirely. "Something did happen to me, David," Elena said quietly. "I was discriminated against, mocked, and denied medical care by our own staff. I was treated exactly like any other patient who doesn't fit their narrow definition of who deserves our services." Dr. Rodriguez turned to look at the reception staff, his expression darkening as he began to understand what had occurred. Maria stepped forward, her professional training kicking in as she tried to assess the scope of the crisis they were facing. "Dr. Harrison, can you tell us exactly what happened?" Elena's recounting was precise and measured, delivered without emotion or embellishment. She described every interaction, every dismissive comment, every assumption that had been made about her worth based on her appearance and insurance coverage. As she spoke, the circle of staff around her grew larger: nurses, technicians, billing specialists, and other administrative personnel, all listening in growing horror to the systematic discrimination that had been revealed. "I asked to speak with the practice manager," Elena concluded, "and was told that you were too busy with important matters to explain basic appointment procedures to every walk-in who thinks they're entitled to special treatment." Maria's face had gone completely pale. "Victoria, is this true?" Victoria's voice was barely a whisper. "I didn't know who she was." "That's not what I asked," Maria said sharply. "I asked if what Dr. Harrison described is true. Did you treat a patient this way?" "Yes, ma'am." The admission hung in the air like smoke from a fire that was still burning. Elena looked around at the assembled faces, seeing shock, embarrassment, and understanding in equal measure. These were good people, most of them, who had somehow allowed a culture of elitism to take root in their practice. "The question isn't whether Victoria knew who I was," Elena said, her voice carrying to every corner of the reception area. The question is why anyone thought it was acceptable to treat another human being that way, regardless of who they were. A young physician's assistant spoke up from the back of the crowd.
Dr. Harrison, are we really seeing patients like that?
People who are being turned away because of their insurance or their clothes? Elena nodded sadly. I suspect so. In fact, I'm certain of it. What happened to me this morning wasn't an isolated incident. It was too practiced, too smooth, too confident. This has been happening for a while, and we've all been too comfortable in our privilege to notice.
Dr. Rodriguez stepped forward, his face grim with understanding.
Elena, what do you want to do about this? Elena looked around at the faces surrounding her, staff members who had dedicated their careers to healing and helping others, who had somehow lost sight of the fundamental principle that medical care was a right, not a privilege to be dispensed based on arbitrary judgments about worthiness. I want us to remember why we became medical professionals, she said simply. I want us to treat every person who walks through those doors with the same respect and compassion, whether they're wearing designer clothes or secondhand coats, whether they have platinum insurance or Medicaid, whether they drive luxury cars or take public transportation. She paused, looking directly at Victoria, who was still frozen in her chair like a statue of regret. I want us to understand that the measure of a person isn't their bank account or their zip code. It's their humanity. Maria cleared her throat. Dr. Harrison, what about the staff involved? What consequences do you want to see? Elena considered this carefully. She could fire them all, certainly. Their behavior had been inexcusable, discriminatory, and potentially illegal. But destroying their careers wouldn't necessarily change the culture that had enabled their behavior in the first place. I want them to spend time in our community clinics, she said finally. I want them to see how we treat patients who can't afford private care. I want them to understand that medical need doesn't discriminate based on economic status. She looked directly at Jessica, who was still crying. You're young, Elena said gently. You can learn from this, but you need to understand that every person who seeks medical care is someone's mother, father, child, spouse. They deserve your respect, not your judgment.
Turning to Carmen, she continued, You've been here long enough to know better. Your silence made you complicit in discrimination. That needs to change.
Finally, she addressed Victoria directly. And you, Victoria. Your behavior this morning was cruel, unprofessional, and potentially dangerous. A patient with serious symptoms was denied care because you decided she wasn't good enough for our practice. What if her condition had worsened while she searched for care elsewhere? Victoria's voice was barely audible. I'm sorry, Dr. Harrison. I'm so sorry. Elena studied her for a long moment. I don't need your apology, Victoria. Our patients do. All of them. The ones you've turned away. The ones you've made to feel unwelcome. The ones who left here feeling less human than when they arrived. The reception area fell silent, except for the quiet hum of the air conditioning and the distant sound of traffic beyond the floor-to-ceiling windows. The morning sun continued its journey across the sky, but the light now illuminated a practice that was fundamentally different from the one that had opened its doors hours earlier. Elena gathered her worn coat around her and picked up her simple handbag, preparing to leave for her rescheduled appointment. But before she went, she had one final message for the assembled staff. We have an opportunity here, she said, her voice carrying hope alongside disappointment. We can choose to see this as a wake-up call, a chance to remember what brought us into healthcare in the first place. Or we can continue to perpetuate a system that judges people by their appearance rather than their need for healing. She paused at the heavy glass doors through which she had entered hours earlier as an unwanted stranger, and was now leaving as a revealed colleague. The morning light had shifted, casting longer shadows across the marble floors, but the change in atmosphere was far more profound than any movement of the sun. I'll be back tomorrow, Elena announced, her hand resting on the door handle. And I'll be wearing this same cardigan and carrying this same purse. The difference will be that everyone will know who I am. But I want you all to ask yourselves this question. Should that change how you treat me? The question hung in the air as she pushed through the doors and disappeared into the city beyond, leaving behind a reception area full of people who would never again look at a patient the same way. Hours later, as the afternoon sun slanted through those same floor-to-ceiling windows, the transformation was already beginning. Victoria sat in Maria's office, signing enrollment papers for sensitivity training and preparing for her assignment to the community clinic, where she would spend the next month learning to see patients as people rather than potential profits. Her hand still shook slightly as she wrote her name, but there was something different in her posture now, a humility that hadn't been there that morning. Jessica had stopped crying, but her face remained puffy and streaked with the remnants of mascara that no amount of tissues could completely remove. She sat beside Victoria, holding her own enrollment papers, her young face marked by an understanding that would serve her well throughout her career, if she was fortunate enough to still have one. The experience had aged her in ways that no training program ever could, teaching her lessons about human dignity that no textbook could convey. Carmen stood by the window, looking out at the street where Elena had disappeared hours earlier. She was thinking about all the patients she had watched being dismissed over the years, all the time she had remained silent while prejudice masqueraded as professional standards. The weight of her complicity sat heavy on her shoulders, but along with the guilt came something else, a determination to use her years of experience to become part of the solution rather than the problem. Dr. Rodriguez had spent the afternoon reviewing their patient intake procedures, discovering patterns that had been invisible to him before Elena's revelation forced him to look with new eyes. The statistics were damning. Appointment availability mysteriously limited for certain types of insurance, longer wait times for patients from particular neighborhoods, subtle but systematic discrimination that had operated beneath his notice for months, perhaps years. In the billing department, staff members were having their own difficult conversations about the ways they had been instructed to handle different categories of patients. The sliding scale fees that were supposed to make care accessible had somehow become weapons of exclusion, used to determine who deserved prompt attention and who could be made to wait indefinitely. The culture of the practice had been built on assumptions so fundamental that no one had questioned them, until Elena's simple presence forced them all to confront the ugly truth of what they had become. By evening, news of the morning's events had spread throughout the medical community in ways that social media and professional gossip networks made inevitable. Other practices began quietly reviewing their own policies, wondering what revelations might await them if their own staff members were tested, as Elena had inadvertently tested hers. Medical schools added discussions of healthcare equity to their curricula, using Elena's experience as a case study in how prejudice could infiltrate even institutions dedicated to healing. The story spread not as scandal, but as awakening, a reminder that the oath to do no harm extended far beyond the examination room to encompass every interaction between healthcare providers and the people who sought their help. 3 months later, Premier Medical Associates had become something quite different from the exclusive sanctuary it had been that morning when Elena first approached the marble reception desk. The crystal chandeliers still hung from their coffered ceilings, and the Italian leather chairs remained arranged around their brass tables, but the atmosphere had fundamentally changed. The same luxury remained, but it no longer served as a barrier between the practice and the community it was meant to serve. Victoria still worked at the front desk, but her greeting had become genuinely warm rather than selectively welcoming. She had learned to see past clothing and insurance cards to the human needs that brought people through their doors. Her month at the community clinic had shown her the face of healthcare inequality, and she carried that knowledge with her every day as she scheduled appointments and guided patients through their visits. Jessica, too, had returned changed by her experience in the community clinic, her youthful enthusiasm now tempered by wisdom and empathy that would serve her throughout her career. Elena's visit that morning had been the most valuable education she could have received. More important than any certification or training program, Carmen had become something of a mentor to the younger staff, using her experience of transformation to help others recognize their own blind spots and prejudices before they could harm vulnerable patients. Her silence had once been complicity, but now she used her voice to ensure that no patient would again be dismissed based on appearance or economic status. Dr. Rodriguez implemented new protocols that required regular reviews of patient demographics and appointment patterns, building accountability into the system to prevent discrimination from taking root again. The practice began partnering with community organizations, offering free clinics and sliding scale services that were genuinely accessible rather than theoretical. Elena returned to work the following week, wearing the same cardigan and carrying the same worn purse, but this time she was greeted with the respect and warmth that should have been extended to her from the beginning. More importantly, she saw that same respect being extended to every patient who entered their doors, regardless of their appearance or insurance coverage. The practice had rediscovered its mission, not through expensive consultants or formal training programs, but through the simple experience of having their own prejudices reflected back to them by someone who refused to be dismissed. The morning that had begun with cruel assumptions and systematic discrimination had ended with a commitment to genuine healthcare equity, proving that sometimes the most powerful changes come not from policies or procedures, but from the courage to see ourselves clearly and the determination to become better than we were. Elena's story became legend in healthcare circles, not as a tale of revenge or retribution, but as proof that change was possible when people were willing to confront uncomfortable truths about themselves and their institutions. She had walked into that marble reception area as a test of their compassion, and walked out, having transformed not just a practice but an entire community's approach to healthcare equity. Years later, medical students would study the morning when Dr. Elena Harrison was refused an appointment at her own practice, not as a story of discrimination overcome, but as a reminder that the patient in worn clothing might be carrying wisdom that could transform everything you thought you knew about healing, dignity, and the true meaning of medical care. The crystal chandeliers still cast their light across the marble floors, but now they illuminated a space where every person was seen, heard, and valued, regardless of the story their appearance might seem to tell. Sometimes the greatest teachers arrive in the humblest packages, and sometimes the most important lessons come disguised as the very prejudices we need to overcome.